Inflammation is caused by many reasons. When you have inflammation, you're going to have pain. It isn't the pain that's the issue, even though you would think it'd be otherwise. It's what's causing inflammation. The body is highly susceptible to organisms that produce inflammation. This is not an organism issue. The body is also susceptible to thought. There's much evidence, excuse me, there's much evidence that thought can cause many things in our bodies. The study of the mind-body connection is a well-known science in many quarters of science. The study of spirit-soul-body is not. I'm the father of a new field of science known as pneumopsychosomatology. The study of spirit-soul-body and how thought, not just psychologically, but spiritually influences our thought psychologically, and the corresponding release of and balance or imbalance with homeostasis in the body, including nerve activity. We know that nerve activity can be initiated by thought. Why is this feet? Feet. Why feet? Why wouldn't it be some other part of your body? The object of pain is of interest. If we were to, there is a scripture. Now, I'm just talking. I'm not trying to diagnose anyone. I'm not trying to stereotype anyone. But the Bible does talk in Mark 9 about if you put your hand to something, it'd be better you went through life without a hand than to keep the hand and go into hellfire. It's kind of a blunt scripture. I don't like it, but it's there. Also, it talks about feet. If your feet take you to places you shouldn't go, it'd be better that you go through life without a foot, maimed, than to have that foot and go into hellfire. Now, why is that scripture there? It's so gross. And we don't like it. Because it indicates that sometimes how we think is how we speak or act and how we function. I deal with syndromes. So I would consider this particular disorder to be a syndrome, not a true disease. A true disease is when there's something wrong organically in the human body. Like, for example, diabetes 1 is a true disease. Diabetes 2 is not. It's a syndrome. Their whole pathways are different. The whole thing is different. So what kind of thought would create the release of a nerve signal that would find its place in the extremities at this nature? Well, there's the old story about putting your foot in your mouth. You ever heard that old expression? So is it possible that people speak what they think? Would that be a factor? Maybe. Or some of the research that we've had indicates a person who gets this type of disorder are somewhat critical of themselves. They don't really have a peace about their identity. They may serve well, they may function well. There's just this gnawing thing, am I doing it right? So they find themselves compensating through performance. Overcompensating for this lack of identity, which they don't really realize is what it is. So that would release the nerve signal, would be for performance, in order to satisfy the lack of identity of feeling like I got it together. So if I was to talk to a person very long, I'd be wondering, did they have this battle inside? Because I consider this nerve signal that's activated to be of this nature. That's where I'm at with it. Next question.